Good evening and thanks for joining us. Welcome to our COVID-19 update, a special edition on the coronavirus pandemic here on Channels Television. I'm Ladi Akiridoluale. Here are the highlights at this hour. Federal government achieves ramped-up testing capacity, although efficient utilization is still challenging. Lagos governor explains community palliatives distribution process, debunks reports of inadequate materials availability. And Nigerians in South Africa looking after one another as COVID-19 lockdown in that country bites harder. We begin in Abuja, where in an effort to bring testing closer to the people, the National Center for Disease Control says it aims to open at least one testing lab in each state of the federation. At the moment, Nigeria has the capacity to test 1,500 people across its network, but these capacities are not fully utilized at the moment. The Director General of the Nigeria Center for Disease Control, the NCDC, Dr. Chikwe Ihekwazu, who was speaking today at the Presidential Task Force briefing in Abuja, appealed to state governments to focus on ensuring the process works well for the entire population.
It's a process engineering challenge. How do we make the entire food chain work better? It's no longer about capacity. There are enough vehicles. Both the federal government and the state government has done everything possible to release the resources required for the response. Our challenge now is how to connect the dots, how to make the response more efficient. So I'll use my last words here to really appeal to the state governments, their commissioners of health, their public health departments, to really focus on these processes. How to get teams out into the field, identify patients, there may be cases, collect samples, send those samples through the mechanisms that we've set up. Let us increase testing. It is only by increasing testing that we can provide light. We have worked and we will continue to work to scale even further our laboratory capacity. But right now, the limiting factor is not the lab. The limiting factor is getting the right samples into the lab. And that is our collective responsibility in the next 2 weeks.
The Director General of the Nigeria Center for Disease Control, Chikwe Ihekwazu. In Lagos, the state governor, Babajide Sanwo-Olu, has assured residents of the state that a method will be used to distribute the palliatives across the state. Governor Sanwo-Olu says the relief items are meant for the vulnerable in communities and not for the entire residents of the state.
To do this. If you remember that the first set where we saw some backlashes, was CDC, CDA. So when we say to a CDA, we've given you 10 bags, take it to the 10 vulnerable people in your community. And you now see the CDC ringing bell and saying to those that see what Sanwo-Olu has given us, so he's given 10 bags for 500 of us as a community that has been. Those are negative vibes for us. Those were not the instructions that were given. The whole idea was not to feed everybody in the CDA. We know that there are vulnerable people there. We know that there are elderly people there, like you've mentioned, the 89. Those are the ones we said to them to give. So a lot of them just turn into politics and they will now go around and say that he gave us 10 bags for 4 streets to give. We didn't give you 4 bags to give to 4 streets. So we're taking our destiny to our hands. So we're using other strategy. So that's why in the second phase, we've gone around and our people have gone directly to them, and we're going 4th and 5th states, and we're using other model to be able to distribute it.
Governor Babajide Sanwo-Olu of Lagos. Meanwhile, the Commissioner for Health in Lagos, Professor Akin Abayomi, says the state has commenced active case search across communities. He confirmed that the state has visited over 118,000 households in order to identify those infected with the COVID-19 virus. Professor Abayomi says this new step will help curb the spread in Lagos State.
We've embarked on an active case search in community. The idea is to go to hotspots and go from door to door with our health personnel. So far, in the last 2 days, we've visited 118,000 households, and we're looking for the typical symptoms of COVID. We've identified about 119 people who have the symptoms that are suggestive of COVID. But let me remind you that COVID is just one of the viruses that can cause respiratory symptoms. There are many viruses. So the idea is to take samples from these 119 and analyze them, and that will give us an idea of how much activity, COVID activity, is happening in the community. So these are not people that are presenting to us. We are actually going to look for them. The whole idea there is to interrupt the community transmission. So there are three strategies: social distancing. Those that are found to be positive, we admit them into our facilities, so that stops transmission. And then finally, with this active case search in community, we are further trying to identify COVID positive patients and bring them into our facility so that we reduce the opportunity for transmission.
Akin Abayomi, Lagos State Commissioner for Health. Now we go to our Abuja studios where our correspondent Linda Akigbe is joining us now. Good evening, Linda, and thanks for joining us at this time. One of the things that is in the news more recently, especially in light of the new extension to the lockdown in Lagos, Abuja, and Ogun State, is the issue of palliatives. Has there been any update on that situation in Abuja?
Yeah. Good evening, Ladi. Now, a lot has been said about palliatives by the federal government to cushion the effects of the lockdown for Nigerians, particularly those living in Lagos, Ogun, and Abuja. Yesterday, President Buhari, in his broadcast, announced the expansion of a national social register to include 1 million homes. However, there are other non-governmental organizations offering some form of palliatives to poor and vulnerable Nigerians. Now, today in Abuja, the Victim Support Fund Task Force on COVID-19 distributed food and medical items to internally displaced persons at their camps, at one of the camps in Abuja, as well as an institution supporting the national efforts to fight COVID-19. Now, the task force distributed bags of rice, beans, maize, gari, and vegetable oil and salt to these internally displaced persons in Abuja. Now, the task force says it has a target of reaching 27,000 households across Lagos, Ogun, Borno, Adamawa, Yobe, Taraba, and the FCT. Now, critical holders, stakeholders and partners across these states, they said, would also be provided with medical consumables, water and sanitation and hygiene facilities, as well as the personal protective equipment in support of the fight against COVID-19. Now, members of the task force told us today that they are working closely with all the relevant agencies at the federal, state and local government levels to working to contain the pandemic. Now, also, ECOWAS, in conjunction with the Red Cross, is putting together basic hygiene products like buckets, soaps, hand sanitizers, tissue paper for distribution to 4 IDP camps in Abuja. The distribution is expected to begin tomorrow in Abuja. I spoke with a Red Cross official and he told me that their contribution to the exercise will be teaching these people at the IDP camps basic hygiene practices and how to use the items donated by ECOWAS.
All right then, thank you very much, Linda. In our Abuja studios, our correspondent Linda Akigbe joining me with the very latest on the palliatives. Thank you very much, Linda. Now, in the studios here, I'm being joined to discuss the coronavirus response efforts so far, particularly in Lagos, by Dr. Alera Roberts, who is a consultant public health physician. Dr. Roberts, welcome once again.
Thank you. Nice to have you back.
Now, let's start with the issue of community transmission, which was what we were talking about and preventing the efforts in Lagos, the Lagos State Health Commissioner and then the governor and even the Nigeria Center for Disease Control. There seems to now be a very focused effort on the issue of the community transmission and about active case searching within communities to prevent further spread. What can you tell us about that?
Very good. Now, the active case search that is being embarked upon is a very useful strategy in what we call active surveillance for disease. Now, this is where we actually go out and actively look for the disease in the community and then try and work out interventions that we can put in place. So the active case search is going door to door into the households and asking a particular set of questions and seeking out who may or may not have been exposed to the coronavirus. The advantage of that is that we can then identify the hotspots of infection in the community and then bring out specific tailored interventions to assist. Bear in mind, of course, that we are a largely much younger population than the European population. So there's a very good chance that there's been a lot of spread of disease, but what we have not seen is the severity of symptoms that is being seen in Europe.
Now, so in this kind of situation, a lockdown helps that process, doesn't it?
Oh, definitely. It definitely does help that process, because the last thing you need, I mean, you know that Lagos is a very peculiar population where you've got people living on the fringes of the state and even in surrounding states, and yet commuting quite a long distance
into the state,
into the island to work, and then leaving those places of work and commuting a very long distance away back, carrying with them whatever exposure. And we feel that that was some of the ways in which we had the amount of community transmission that we had. So a lockdown is definitely very useful. The question is, as the social scientists would say, at what point does the cure become worse than the disease?
Well, that was actually going to be, because again,
sorry, I preempted you there.
A lot of people have talked about the fact that basically people understand the need for staying in one place while this process goes on. But what has been the experience like of those who actually have to go do this? Because you find that in many instances, people sometimes shoot the messenger.
That's right.
With the, instead of taking on the message. And in this instance, the other side of it is that people are talking about palliatives, which was the last discussion I had with Linda in Abuja. So I was kind of interested in knowing those who are actively doing this case searching, do they encounter this kind of opposition when they actually go from door to door?
To be honest with you, yes, they do. We've had some anecdotal reports of them being met with negativity. But by and large, I believe people do believe the need for the lockdown and do understand the need for the lockdown. Although, it is to be expected. You will have some pushback where there are areas where the so-called palliatives that they believe should have been distributed were not distributed. Now, we heard His Excellency, the Governor, give a very detailed explanation of why some of these things have not been as expected. I mean, you do not expect to go and give 10 bags of rice to a local government chairman and say, distribute to your whole local government. You know, it was intended for the vulnerables. And
that's right.
The issue is that suddenly everybody becomes vulnerable. You know, so there's always going to be those areas. So there has been some negative pushback, but by and large, we are achieving what we set out to achieve. I mean, we have literally reached almost 120,000 households, and I'm sure by the end of this week, we would have reached a whole lot more, and then we'll be able to identify which are the hotspots in the state.
Now, twice now you've talked about identifying the hotspots, and I'm guessing, not being a medical practitioner, that is important because then you're able to more laser focus on those areas. Is that it?
Yes, that is it to a large extent. And also, don't forget, the coronavirus is novel. It is new. In identifying the hotspots, we can then add to the body of global data, which is important in trying to identify the exact modes of transmission. So if we identify, for instance, this is just an example, if we identify, for instance, that the hotspots that are found are directly linked to importation.
Okay.
You know, maybe somebody came back from the airport, his driver took him home, he didn't isolate, and then the driver goes back to his community somewhere.
And takes it there with him.
Yeah, somewhere on the Channels TV Avenue.
Right.
And then takes it there, and his wife, and who has a stall in the market, etc., etc., etc. So we'll be able to now identify the particular pathways of transmission that make it easier for us to stop the spread, as it were, to now put in place specific interventions that can stop the spread.
Now, that is going on one hand. That is the active case search, the door-to-door is good. But also, it is expected that those who self-isolate, discover that maybe they are presenting with some kind of symptoms and so on, continue to report in and have their samples taken and so on. And now that we had the NCDC DG now saying, look, testing capacity is no longer the problem. It's at the level of...
Yes, it's connecting the dots.
That's right.
Like
so now, does that feed into what you've just said about being able to link these people who may be active carriers within the communities, finding them and nailing them down, and then linking them to this process?
Oh, yes, it does. I mean, because if we get into a place, for instance, purely an example here, if we get into a place and we find that, oh, by the protocol we're applying, some people have high index of suspicion, could have been exposed to the coronavirus, we will go ahead and take the tests. They take the samples.
Right.
And then they get back to the laboratory and the tests are done. And actually, in fairness, we've had quite a few cases like that, where the people who were tested weren't exactly exhibiting symptoms, but they have turned out to be corona positive and then have to be taken into an isolation center. And, you know, then we have to take the entire household into some kind of quarantine to make sure we don't get any further spread. Now, this achieves two things. Number one, if the person that tested positive, who may be asymptomatic or mildly symptomatic, has a sudden descent into severity, and if you look at the pattern of the disease in other countries, luckily we're not the first in line. We've got other countries that we're looking at, even the British Prime Minister. You can see that at about 9th, 10th day of exposure and symptoms, there can be a sudden descent within hours. You want that person to be in a place where he or she can be properly cared for.
Now, but it does also appear as if some of the biggest obstacles to holding this thing down are these asymptomatic people.
Absolutely.
Because they don't present with anything.
Exactly. If you're not ill, you're not ill. That's just the truth.
And yet you are a problem because you can spread it.
You can spread it and you can become ill pretty quickly.
So, in that kind of situation, if I don't present with any symptoms, and therefore I don't want to clog up the NCDC hotline by saying, look, I haven't sneezed, I'm not coughing, and I don't have respiratory difficulties as at now, but I'm just suspicious. And they say, look, we're not looking for suspicious, we're looking for actual...
We've had quite a few of those as well, what we call the worried well.
Right.
You know, people who sort of say, well, I think I might have been exposed. I went to this office and the gentleman had just come back from a European hotspot area, and I think I might have been exposed. Please test me. We don't really have the capacity to do that yet, so we would wait for 1 or 2 more indicators that would put you in line for that kind of testing.
Now, as we now move into this phase of the lockdown, the president offered an explanation because he said, look, in the first 2 weeks, as uncomfortable as it was for quite a lot of people, we did achieve a lot, which you may not see.
We did.
Trained quite a lot of health professionals, ramped up our testing capacity.
Absolutely.
Virtually every state has an isolation center or at least a unit in a hospital too. Now, in this second phase now, and by that I mean in this second 2 weeks, what are those key places that you think we should focus on? I'm being told that we're going to have to take a break in about a minute. So if I have to stop you, I will stop you, and then you continue with your thought after the break. But please go on.
Well, the active case search, the active surveillance is important. And now the federal government has this active surveillance mechanism, which it had set up nationwide, which started even before Ebola. It started actually with the polio. Right. So we have to be able to strengthen that mechanism. And this is just a fantastic opportunity to do so, where we're getting people actually attuned to the fact that seeing a disease in your community, of whatever type, it is important to notify the authorities.
Let me put you on pause, Doc. We'll take a break, and when we come back, we'll continue this very interesting discussion with Dr. Roberts, so please stay on with us. All right, thanks for staying tuned. Welcome back. I've still got Dr. Alera Roberts, consultant public health physician, in the studios, as I said before the break. She'll continue with her line of thought, but first, we've got some breaking news, not particularly good. The Nigeria Center for Disease Control has just confirmed 19 new cases of COVID-19 in 5 states of the Federation. There on their website, you can see the summary as at April 14th. The total confirmed number of cases now stands at 362. On a brighter note, the number of discharged patients is now 99, while the number of deaths, sadly, has risen by 1 to 11. The breakdown of these 19 cases shows that Lagos has 14 of them. The Federal Capital Territory, Abuja, has 2, while Akwa Ibom, Edo, and Kano State each have 1 case. So, 19 new cases, that's just been announced by the NCDC. And let's go to one of the states where where 1 new case has just been confirmed, and that is Kano, where the state government has announced a week of restriction in the state starting from 10 p.m. on Thursday, the 16th of April. Governor Abdullahi Ganduje, while making the announcement, said his administration will do all that it can within the 7 days lockdown to trace all contacts of the first index case and the contacts of the other 2 people who came back from a foreign nation and have since isolated themselves. We are now being joined by our correspondent in Kano City itself, Idris Chibrin. Good evening, Idris. What is the governor saying specifically in terms of measures to prevent this spread now that another case, the 3rd one I believe it is, has been confirmed in Kano?
Yeah, good evening, Ladi. Like you said, Kano State has just, like the NCDC, confirmed another case in Kano State, bringing the total number of positive cases of coronavirus in Kano to 4. Governor Abdullahi Ganduje has just also confirmed that particular case and also imposed a total lockdown of the state, like you said, effective from 16th April, that's on Thursday, by 10 p.m. The governor went further to say that during that period, all mosques, churches, and marketplaces and all other public places will be in a total shutdown for initial 7 days. And he said this will give the state government an opportunity to trace other contacts so that they can be able to find a way of testing them to confirm other cases. Now, in terms of measures to contain the spread of this COVID-19, the governor says that a number of strict measures have been put in place in addition to the isolation centers that the state already have. He announced that henceforth the tricycle operators will no longer be carrying 3 passengers, 1 passenger, 1 tricycle. And that restriction has also been extended to taxi and buses. They will not be carrying as much people as they used to be carrying, but that has gone because of the total shutdown of the state that will be effective from 16th of April. So this came after the emergency meeting between the state task force on COVID-19, which is being chaired by the state deputy governor, Nasir Gauna, and religious leaders, after which they recommended to the state governor, given the current circumstances, that the total lockdown should be effective in the state. And the governor has agreed and announced that the state will be in a total lockdown from Thursday, 10 p.m. So as it is now, from 10 p.m., Kano will be in a total shutdown. There will be no movement. All markets, all mosques, all churches, all overcrowded areas will totally be closed down for an initial of 7 days.
Now, Idris, you're talking of Thursday. Today is, in fact, Tuesday. What are the citizens of Kano expected to do between now and 10 p.m. on Thursday? Is that some kind of release period to stock up or something before the lockdown?
I think basically the reason why the governor gave Thursday is to allow the residents to prepare for that particular day. So in the next coming days, between now and tomorrow, actually you are going to see a lot of people making last-minute shopping, going to the markets to get themselves prepared, especially as it remains just few days to Ramadan fast. So residents will get prepared for that. And then the governor also announced that in addition to that, there is going to be some palliatives that the state government will soon begin distributing to residents that may likely be affected by this total lockdown. So from tomorrow, we will start monitoring some marketplaces and other overcrowded area to to see how people will be preparing for this total lockdown. But Ladi, like you know, Kano is one of the most populated states in northern Nigeria, and we have many markets that are very, very congested. So I must say that it's going to be a very difficult moment for residents. But I'm very much sure that from tomorrow, people will start preparing for a total lockdown of the state, in addition to what the state government would be doing for them through the committee.
All right, then. Thank you very much, our correspondent Idris Jibrin, reporting there from our Kano studios. Thank you, Idris, and we trust that you'll keep us updated on what's going on. And we return to the studios here where Dr. Roberts is. Before the break, you were talking about what we should use the next 2 weeks to do, the particular things, the specific things. Now, what the report from Kano indicates is that at subnational level, states are still reacting to what is going on in their individual states.
Absolutely.
So Kano is on a lockdown, but there are other states that are relaxing some of the restrictions that we have. But let me get back to what you were saying about what are the things that we're supposed to do. You stopped at the point at which you were saying that we should use this period to pinpoint where the cases are and what we're supposed to do with those cases and so on.
Yes, well, subliminally, the most important thing is to strengthen our active surveillance mechanisms. That is that. And in strengthening the active surveillance mechanisms, we are now bringing it, making people more aware of what is going on around them disease-wise, and making sure that they can identify the reporting channels, so to speak. Who do they tell if something, like you quite rightly said, that so somebody now discovers that he's corona positive, but he's asymptomatic. What does he do? Who does he tell? And these are some of the mechanisms that need to be strengthened. Lagos is peculiar. Lagos is unique in its what we call informal social networks. And there are a lot of communities and communities within communities that can use the next 2 weeks to strengthen these informal social networks. We're hearing of reports of rising incidences of insecurity and bands of hungry youth, parading the streets, holding up placards saying, "We're hungry, feed us." This is the opportunity for communities to arise and strengthen those community networks. They're informal, but we shouldn't see it as an us and them situation. We should see ourselves as one holistic, organic community, and then be able to strengthen those informal social networks, which not only serve to identify active cases, but also serve to identify the vulnerables within the community to whom useful palliatives can be given.
Now, I've been asked this several times, and because I'm no doctor, I said when I get a doctor, I'll ask. And that has to do with, if I'm asymptomatic, but I am suspicious, and I'm observing all the protocols, I'm washing my hands regularly, I'm keeping the distance and all of that, can I keep that up until I present with symptoms?
Or not,
or
yes.
Not?
Absolutely.
I
We
can do
must
that.
emphasize that it is important that you sort of isolate at home, which is the quarantine, which is the self-isolation, which is the keep at home. You keep up with the hand washing, you keep up with the respiratory hygiene, you keep up with the sanitizing of surfaces, and you be watchful. Keep yourself hydrated, well fed with lots of natural food and fruits and vegetables. This is not the time to binge out on alcohol, I'm sorry.
Indeed. Now,
but you must keep that, it works. It works. And you might become symptomatic, you might not become symptomatic. You might become very mildly symptomatic, but if you keep to those protocols, we are only going to, you will probably ride it through.
Now, something else that is increasingly coming up because of this lack of symptoms, so to speak, is that there are people who have COVID-19, but because they present with no symptoms, they tend to argue that there's nothing wrong with them.
Absolutely.
And it then becomes a difficulty for them to submit themselves to the protocol that requires you to self-isolate, to quarantine yourself, to submit yourself for tests, and then when it turns out positive, not to go home, but to then be moved to the isolation center. We've had one such case, possibly, because the contending parties are still arguing, in Benue. And of course, one of the doctors who was on an earlier version of this program talked about another case in, I believe it was Anambra. So now, when that kind of situation happens, what would you tell a patient in that kind of situation that tends to ease the mind of the patient?
It's very difficult. It has to be taken on a case-by-case basis. And I think the reason why these incidences are coming up national news is because they're actually very rare. And therefore, you know, we haven't really developed a protocol. I mean, you cannot override a person's basic human rights of freedom. You understand? All you can do is appeal to his or her sense of social justice, as it were, and say, listen, these are the issues and these are what we must look at. Now, I know I've been dealing with a couple of cases where the family, for various very good reasons, cannot go into isolation. You know, there's a mother with 3 young children, and she can't leave 2 children home alone and then take, you know, so that's a very reasonable situation. And we actually had a 4-way discussion, several of us, the clinician, yes, the infectious disease specialist, the NCDC chap, and we said, look, she's intelligent enough to do what we ask her to do. Luckily, with technology, we can do a face-to-face on video chat.
Right.
And we'll continue to manage her where she is in her house. And if things go bad, we know where she is and we know what to do. And she would also know at what point she says to say, hey, temperature hasn't come down in X number of hours.
Indeed.
You know, and this. So we can manage these things. These are individualized cases that we can manage on a case-by-case basis. So basically, we will appeal to everybody's sense of social justice and everybody's sense of the right thing to do.
Now, we've got 13 days. The medical personnel have got another 13 days now to provide us with, if you like, a silver bullet that at the end of it, we wouldn't be needing further extensions. Which is why I asked about what are the priority things that we need to do between now and then to ensure that this doesn't go beyond this. But as it is now, you talk about Lagos being peculiar. That obviously is well recognized, but at a national level now, if we're talking nationally, what in terms of measures, you just heard what is going on in Kano. Our correspondent there talked about Kano. Now, there are other states. We're going to be hearing in the course of the program from other states, technology permitting. But it does seem as if at the national level, we also still need a strategy.
That's a very difficult question to answer, Ladi, because I think by and large, we would be looking for data that would tell us that the genomic sequence we're looking at in the coronavirus definitely came from outside the country and is not a homegrown species, as it were.
Okay.
We would be looking for more evidence of the severity of symptoms in different age groups. So far as we know, the mortality rate in the under 25s is so low, doesn't even compute statistically. So we're looking for more data. Is that a peculiarity? Is that the norm? Is that what is to be expected? There's still a lot we don't know. The modes of transmission, we do know what we know and we're protecting against that. Are those the only modes of transmission? Is there some nasty thing that's going to jump up and bite us if we're not careful? I mean, we know that other countries, and luckily, this is one time where I'm kind of glad we're behind the queue. So there are other countries we can watch and see, well, how are you handling this? I mean, there's a European country that is doing kind of like a phased reversal of the lockdown. Right. Now, we're all going to be sitting back and watching to see how that works. Is there going to be a spike in cases? I mean, we're looking at some spikes in cases in China even right now. And
that's right.
Is that a reinfection? Because we don't even know whether having been exposed to the virus and thrown it off, you now end up with any lifelong immunity, a period of immunity for, say, 6 months to a year, or whether, like the common cold, you can have a cold yesterday, get over it today,
and then tomorrow it's back again.
Have another cold. It's actually another cold. You know, so we still want that data. And we're part of a global network of researchers who are looking into all these aspects. So no, I don't have a silver bullet for you in 13 days, but I know that in 13 days we'll be a lot more knowledgeable than we are today.
That's a very optimistic note, and that's a very good way to wrap it up. Thank you so much for being with us, Dr. Alera Roberts.
Thank you very much for having me. It's always a pleasure to have you with us. Dr. Alera Roberts, of course, is a consultant public health physician, has been talking to us about all the latest developments on this matter. Now, one country that seems to be, as it says, getting a hang of what's happening
is South Africa, where as the number of confirmed COVID-19 cases does continue to rise, all hopes of going back to business soon are hanging in the balance. But for many self-employed Nigerians in that country, it is getting even harder to put food on the table. To make things a bit easier, several Nigerian community associations in South Africa have been bridging the gap by reaching out to those in need. Basic need packages, according to family sizes, are being handed out. Our South Africa Bureau Chief, Palliatives, joined two of the associations as they reached out to others.
The past few weeks have been tough for the world, no doubt. And for many Nigerians who are self-employed living in South Africa, the outlook is still a grim one. This is Kempton Park in Johannesburg, from where we have brought you a number of stories involving Nigerians. But it's so difficult to believe that this is a working day or a weekday in the area. Courtesy of the lockdown, many of the shops are closed, and many Nigerians trade on a day-to-day basis here.
Here in Kempton Park, it's very tough since this lockdown. People have been crying for food. A lot of people, they have been crying. Even many of them are in the street now looking for one thing or the other to eat because they're always based in daily bread.
To help out, several Nigerian community groups are reaching out across the country to fellow citizens. We caught up with the Nigerian Citizens Association (CASA) in various parts of Johannesburg. Some of the packages they had were home delivered, while other beneficiaries came out to collect at various points.
I got 4 children. It's not easy for me. So to survive is not easy for me at all. It's not easy for everybody. So we are just struggling to survive. So may God bless you people.
Through these structures, we hope to reach those ones that are really in need for immediate relief of, because we don't know how long this will continue. And at that, we also want to show appreciation to those Nigerians that have come, on board to show support to what we are doing. We are working with what they have given to us.
In Pretoria, we joined the Nigerian Union South Africa doing the same across the country as well through their structures. They say support of the initiative from fellow Nigerians has been overwhelming.
In fact, there is one that touched the heart of the National Executive, a student of UJ that donated 500 rands to say, please help me use it for people that are in need. And I'm giving out of my widow's mite. So we National Executive came up with the idea. We bankroll it, the first phase, from our pocket. Then people came to our aid.
Yeah, it's because of lockdown I cannot do my business, so I'm short of food. So when I heard that they said we should come, then I have to be here to come and collect. And I want to say thank you very much and God bless you.
Many families, some non-Nigerians, had a nicer Easter than they expected, and the Nigerian community hopes to do much more.
I just want to thank our Nigerian community for providing us, for helping us with this grocery so that we can put bread on our table for our kids.
The challenge we faced so far is being able to have a proper database of the needy, as we are ready to step up our efforts in giving more materials should the need arises.
With the lockdown extended, many businesses remain suspended, but with these gestures, which is still ongoing, at least many immediate needs will be attended to. From Johannesburg, South Africa, Betty Divya, Channels Television News.
All right, that report from South Africa talking about Nigerians being their brother's keepers. We'll take a break now, and then, of course, when we come back, we'll talk about how things are outside our shores, where more than or nearly 2 million people now have been confirmed to have COVID-19 in more than 185 countries. We'll also have the stats of people who have died and those who have recovered, as well as the view from one of the countries which is fighting its way through this pandemic. Please stay on with us.
My name is Delichukwu. I live in Lekki, and it's been an experience for me, particularly being confined to the space of my house, from the rooms to the sitting area to the kitchen. I've tried to clean up. I stay alone in my house. My families have all gone different ways, and they're also on lockdown in their respective locations. So after cleaning everywhere over and over again, and there was no more things to clean, I settled to either study my Bible and play music, watch the news, also reach out to friends and contacts, asking them how they are doing. Those I could reach by telephone, and some of them by video calls, just to see that they are fine.
Thanks for staying tuned. Welcome back to our COVID-19 special here on Channels Television at this hour. Now, outside our shows, there are nearly 2 million confirmed cases of COVID-19 in 185 countries. About 120,000 people have died, and the death toll is still climbing. But more people have been recovering from the infection than are dying with it. As the world races to curb the virus, many countries remain under lockdown. As a result of the pandemic, the IMF says the world faces its worst recession since the Great Depression. All right, let's move on to Manchester in the United Kingdom, where a consultant anesthetist, Dr. Kingsley Enoma, who is at the Tameside Foundation Trust Hospital there in Manchester, joins us via Skype to look at the COVID-19 situation in the United Kingdom. Just a few grim statistics. 95,000 confirmed COVID-19 cases have been recorded, with over 12,000 deaths. Good evening, Dr. Enoma. I hope I'm pronouncing that correctly. Thank you for joining us at this time.
Thank you for having me on your program.
Now, some really grim statistics out of the United Kingdom, but we've had the Prime Minister go in and come out, and he says the NHS saved his life. What does that say about what's going on with the battle the NHS is facing with this latest virus?
Yeah, good evening to your viewers. And like I said, thank you for having me again on your program. This is unprecedented pandemic that has ravaged the whole global crisis, that has caused global crisis across the globe. I feel the NHS has been in the forefront. My heart goes out to all of my colleagues who have been in the forefront looking after all of these patients, and also the key workers who have been also minding and caring for all of these patients. Nothing in medical school have prepared you to deal with this sort of pandemic. And I'm happy to be one of those working within the NHS that is providing these services to all of these patients. It's a great figure, like you said. As of today, about more than 90,000 people have tested positive in the UK, and we have had about over 700 deaths as of today. And of course, 12,000 deaths as of today. And of course, most of these deaths that we're recording cuts across all ethnic groups, cuts across all age groups, and it is by no means a health crisis that we are facing in our hands.
Now, in that kind of situation, previously, it seemed as if it caught many countries unaware, the UK not excluded. But now, would you say you're having a sense that the country is finally coming to grips with it and finally, getting its hand around it by the scruff of the neck to be able to put it under control?
Absolutely. I think, like you said, observed there, I think most of the countries were initially dragging their feet in terms of what to do and how to go about it. But I think we've got a grip of it now. Where we are within the curve is we are actually this week and next week, we think it will be at the peak. We are at the peak of the infection. And so after this week and next week, we hopefully will be seeing a cut down or a slowing down of the infection. I would like to just mention here that one of the things, or most of the things that have actually helped in slowing down the spread of the infection is the lockdown that we've had, the social distancing, and also the hand hygiene, washing of your hands, using the sanitizer, and also reporting the symptom testing for all this coronavirus. I think all of that, and the public really, they have to be appreciated for bearing with the government to stay at home and go through with all of these measures that have been put in place to try and slow down the infection. Having said that, I think again, the lockdown is not something that people are used to, because if you look at schools may close, churches, you don't go to church. But I think it's the right thing to have done at that point in time to have slowed down this infection. And I thought, of course, all the PPE, all the equipment that all the NHS staff require, we now have them. And I think that is what has made a change in terms of the numbers we are seeing daily. We will see this number go up. But again, we are at the peak of the curve, and we expect that this will go in the next couple of weeks. The number of new admissions with coronavirus has actually declined, particularly across the hospitals. In my hospital, for instance, we've not had more than few infections, few patients coming in that have been tested positive. So I think we are really turning the bend, and I think my heart goes out to all my colleagues within the NHS who have put in their lives on risk, put their lives on the line to ensure that patients who come through the door are treated, and patients who are within the hospital are also treated to get them off to their homes when it is apparently necessary.
Dr. Onoma, thank you so much. We're going to have to leave it there. Dr. Kingsley Onoma, of course, joined us from Manchester in England via Skype. Dr. Onoma, thank you so much for it. So that's where we're going to wrap it up on the program today. Just to remind you that during the course of the program, the NCDC confirmed 19 new cases of COVID-19 in Nigeria. Do join us tomorrow. Please keep the tweets and the short videos of what you're doing during this lockdown coming to Channels Television. The handles, of course, you know them. My name is Ladi Akeredolu Ali. You have yourselves a good evening.